We'll give you a couple minutes to connect. For those of you who are having trouble, we'll just wait about a minute before we get started. Thank you. Okay, well, hopefully everyone is connected. Again, good morning and welcome to the webinar, Stakeholder Engagement in the Times of a Pandemic. My name is Angela Miller. I'm a Principal Environmental and Social Specialist at IDB Invest. I lead our social cluster in the division. Today's session is going to be divided into two parts. First, we'll hear about a guide that we've developed on virtual stakeholder engagement, which we published this month, with the idea of helping our clients decide how to proceed when face-to-face meetings and engagement isn't possible. So that's the first part of this webinar. The second part, we're lucky to be able to hear from 3 of our clients about their experiences in the region and how they've been able to conduct stakeholder engagement during this pandemic. We're also lucky to hear from our IDB colleagues and about their experience working on public sector projects. So some announcements quickly before we start. We are lucky to have about 150 people connected today to our event. So first of all, thanks to everyone for your participation. Secondly, just a reminder, all of your microphones and cameras will remain off during the session. We do have translation into English, Spanish, and Portuguese available. So if you click on the world icon at the bottom of the screen, on the bottom right-hand side, you'll be able to access simultaneous translation. So I'll give you a few seconds to locate that. It's the world icon at the bottom of the screen. And then fourthly, we've set aside some time at the end of the webinar for you to be able to ask questions and have a dialogue. So please submit your questions in the Q&A icon at the bottom of the screen. You'll see that, so that we can respond to those questions and have a discussion at the end of the webinar. Well, with this, I'd like to pass the word on to my colleague, Fiorella Pino, who's based in our Bogota office. She's been leading this great effort and she'll be moderating the session. So with that, I'll pass the word on to Fiorella. Thanks, everyone.
Muchas gracias, Ángela, y bienvenidos a todos. Es para nosotros un placer.
Thank you, Angela, and welcome to all. It's a pleasure to have you all connected. My name is Fiorella Pino, and I am a lead environmental and social officer at the IDB Invest. For this first session, we're going to divide it into 2 sections. First, we're going to have Katie Stevens, who's a partner of Sustainability Framework, and then we'll hear from our special guests, clients with different projects. We have Daniel Mascareñas, who's a social responsibility coordinator in CELSE. Then we'll hear from the Cocoa route. We'll have Elsa Ruiz and Dolly Baron, and then Fanny Rivera, who's an environmental and social professional in EPM, the Irituango project, and then finally Julio Rojas, who's a senior social specialist in the IDB group. And now I'd like to give the floor to Kate so that she'll begin to share with us the content of the virtual stakeholder engagement guide. Thank you, Fiorella, for your introduction.
My name is Catherine Stevens, and today I'm going to walk you through the BID Invest guidance on virtual stakeholder engagement. As Angela mentioned, this was produced to support you in engaging with stakeholders during COVID-19 or any other situation when it's not possible to conduct normal face-to-face engagement. We're going to start with a quick recap on why we engage, and then we'll look at the guide itself and discuss some of the main contents so that you can get a feel for how it might be useful for you. So first, why is it important to maintain engagement when you no longer have direct access to communities? The most important reason is that we engage for our long-term engagement objective is to build and maintain trust with local stakeholders. Obviously, we can't do that if we just walk away from communities which we've been working with either for several months or several years, especially in a time when they may be struggling. Even in low risk situations, there will normally be issues that need to be addressed, processes that need to be closed out, and new situations that need to be assessed and understood. And none of these can be done by effectively walking away. Sorry, por favor. In addition, BidInvest has a set of expectations for all its clients. The first is that clients will continue to engage as much as appropriate and according to the circumstances of the project by adapting to the new circumstances. And the second is that clients will continue to meet all their legal and regulatory obligations, and if they can't, to negotiate with the relative authorities as appropriate, but to do all this without endangering the health and safety of any of the stakeholders. So the question then is, how do we do this? If we turn to the guidance itself, this is an in-depth guide which has been developed mainly as a reference document that can be dipped into whenever you need it. It's not designed to be read from beginning to end. First, it provides step-by-step processes for how you adapt engagement plans, community development programs, grievance mechanisms, and others of the sorts of processes that you use in stakeholder engagement to your new circumstances. It looks at a broad range of issues that you might face in the context of virtual engagement, such as gender, literacy, barriers to access in the virtual environment. It provides advice on the types of tools and techniques that can be used for different types of engagement and under what circumstances. And it includes a very detailed set of tools in Annex 1 to the document, which will walk you through exactly how to adapt a stakeholder engagement plan, including all the types of questions that you need to ask of the company and the community in a very step-by-step process. It includes a lot of examples of how various IDB Invest clients have adapted engagement approaches over the course of the last few months. And lastly, it provides a set of tips and reminders about all the sorts of issues that might come up when you're trying to choose a virtual engagement platform and the types of challenges that you might face in how you approach them. We'll look quickly at a series of 10 actions for meaningful engagement. The guide starts with a review of the 10 elements and principles for meaningful engagement, which provide the fundamental principles for why and how you engage. And I'm sure you're all familiar with those. What we developed was a set of 10 actions that you need to, that people need to think about and to action as soon as a new situation is, we're facing a new situation. So firstly, we have to start by avoiding all the engagement processes that under a pandemic situation, which could endanger the health and safety of both the workers and communities. And in most cases, particularly if you have a large project under construction, most organizations will fairly rapidly have to develop a set of risk-based protocols that govern how staff and contractors interact with local communities in order to prevent disease transmission immediately. That obviously needs to be consulted with the local community and socialized with them, and the staff and contractors will need to be trained around those protocols as your sort of initial fix for how to prevent disease transmission. Once that is in place, we need to then revise our approach to stakeholder engagement, which is a longer process whereby we have to stand back and think about what we really need to do and why we're trying to do it. And we also have to think about how we can demonstrate our commitment to the local communities in order to ensure that they understand that we are still there working with them and for them. When I talk about demonstrating commitment, I'm thinking about things like very simple actions one might take in terms of providing PPE or instructions, making sure that communities are fully aware of the dangers of disease transmission and how that might be prevented. And in some more complex circumstances, that might go as far as providing short-term financial support to local businesses that are impacted by a temporary shutdown of a plant, for example, advice on setting up home offices, if that's relevant in this particular community, or providing doctors, helping communities navigate links to local health authorities, and so on and so forth. There are all sorts of ways in which commitment can be demonstrated, But if we're looking at the long-term relationships we're trying to maintain with our communities during a difficult time, then demonstrating commitment to them is one of the most important things that we can do. Other actions that we need to take is just to remember we must keep the community informed at all times about what we're doing, because things are changing quite rapidly. We need to also make sure that we're continuing to respect the issues and concerns and the stresses that are facing families and individuals in a difficult time, and not to expect them to be able to act and react in ways which they would necessarily under normal circumstances. Other things we need to do, we need to review our grievance mechanism, we need to plan for return to a new normal, and we need to make sure that we continue to abide by all national and local regulations. So when do we use virtual engagement techniques and technologies, and which are the most useful for us? The answer is that we can use virtual engagement techniques really for most of the types of engagement activities that we normally undertake. So there are techniques that we can use for information disclosure, for consultation, for collaboration, for undertaking surveys, and so on and so forth. There's when we sat back and thought about this, what we realized that a lot of the techniques which we use under normal circumstances are actually really continue to be extremely useful when we can't do face-to-face engagement. So, for example, the most useful tool it remains the telephone. Other tools which we continue to use that are very effective are local radio, megaphones on trucks, posters, continue to be extremely useful means of communicating with and sometimes consulting with local communities. But we also discovered that, as I'm sure you've discovered too, that the new technologies which have become available in the last few years, such as WhatsApp and Zoom, which we're using now, also have their place in a virtual engagement setting, as do some of the much more sophisticated engagement platforms in circumstances where we have good penetration of computer technology and internet. WhatsApp and Zoom, or WhatsApp can particularly be used really with a lot of communities, as even a lot of indigenous communities now have access to cell phones. And we found Zoom particularly useful for communicating with community leaders. So one of the things that we have provided in this guide is a very simple table which looks at all the different types of approaches that we use in community engagement, and looked at both the traditional and the non-traditional technologies that we can use for those particular approaches for different applications. So this particular example, for example, is the grievance mechanism. And if we look at the applications, you can see, for example, that the telephone is very useful when you're trying to resolve grievances for one-to-one conversations and interviews. Zoom and Microsoft Teams have been extremely useful for multi-party conversations and discussions. And when you're trying to do surveys or do reviews, site reviews, take photographs of issues which have occurred on site, then with the permission of local communities, drones have become extremely useful, and Google Earth obviously is also a very useful tool. So this as I said, there's a table in the guide which runs through all these types of options. If we can go to the next slide, we've also provided some examples of how different, and this is an amalgamation of experience based on a series of interviews, examples of how different companies have adapted their techniques to specific circumstances. So if you take the field research and surveys, for example, we discovered that different companies, some companies decided to use a situational diagnostic on the telephone instead of face-to-face questionnaires. Some one company was able to use an existing government platform to run a questionnaire because it was, I think it was a health questionnaire, and so they were able to use the Ministry of Health's existing platform that was available in the local communities. And others have used WhatsApp surveys and drone photography and directed cell phone and video calls to conduct surveys. So there are all sorts of different options available according to what is both culturally acceptable in a specific community and what's also technically available. If we can move to the next slide quickly. As I mentioned, one of the main focuses of this guide is how to go about adapting to your engagement to new circumstances. And obviously, it's difficult to just plunge into a whole set of new techniques. You really need to step back and say, why are we engaging and what are we engaging about, and how has our context changed, and how have our own objectives as a company changed in order to develop a new plan. So what we've developed is a four-step process for adapting engagement, which starts by thinking through the company's priorities for engagement, continues to understanding the context that you're operating and the needs and concerns of the stakeholders, and then helps you to set up new engagement objectives and design a new approach that's appropriate for that engagement, those engagement objectives. In terms of the company priorities, you may be in the middle of a consultation process for permitting when the pandemic hits and had to stop in your tracks. So your main question under those circumstances will probably be, how do we finish with this particular process and get our permitting back on track? Another company may have had to send their workforce home and needs to keep them physically and mentally healthy for the return to work and keep working remotely wherever possible. The shutdown may have impacts on local businesses and family life. And how do you deal with that during a pandemic? Another company that's in the middle of building a road, can they continue? Do they have to slow down or stop? What are the new health and safety parameters and protocols that need to be communicated? And does the community want the crew there at all? Or do they want to send them home? These are all the sorts of issues that a company might be facing and that need to be dealt with, and that will result in a company having a new set of objectives for engagement at this particular time. In terms of the community context, step 2, you may need to understand, you will need to understand how the community context has changed in order to understand the sorts of engagement approaches which you can move forward with and which will be meaningful for them and that they will be prepared to engage with. So you need to understand their new needs and their new priorities. You also need to understand if there are new figures of authority emerging in local communities. In several, for example, the medical professionals have suddenly become the most important key figures in communities, whereas before they were professionals within the community, but perhaps not quite so prominent. We need to understand the changing pressures on daily life. We need to understand the willingness and the ability of the community to engage with a company at this time when they may have all sorts of other pressures. And we need to understand the types of engagement processes that might work when you can't do it face to face. These are not issues which we faced before necessarily. And so we have to go through this thought process to think through what is different. If we move to the next slide, what we've done to try and make this easier is to break the process down into much smaller steps. And then, as I mentioned earlier, in the annex to the guide, there are some very, very detailed processes that will walk you through exactly the sorts of questions that you need to be asking of local communities, the sorts of surveys that need to be undertaken according to your particular context. Now, some of you are probably thinking that this is all much too detailed, and for some projects that will definitely be true. What's also true is that every project will need to go through this thought process to a greater or lesser degree. Because that's how, as a company, you're going to be able to go, you're going to be starting to manage your stakeholder risk. The processes might be the process that you as a company need to go through might be as simple as doing a quick back of the envelope review and making a few small tweaks to your existing engagement and or community consultation process and the tools and techniques that you're using. However, for many companies, there will be major changes to the short-term objectives and the engagement focus that will reflect the unexpected change to the circumstances and the associated engagement priorities. We can move on to the next slide, please. We've jumped a couple here. I'm now going to talk about the content briefly. The sort of issues, there's a broad range of issues that are covered within the guide, from gender, how you deal with gender issues, reprisals, how you deal with engagement in specific circumstances, how you build capacity in community technology, when to postpone or delay engagement, how to identify and address barriers to access, for example, in the when you're redesigning your engagement program, and all of these issues are discussed in depth in the guide, and you can just dip into them as and when you need to. We also have provided processes for a go, no-go decision tree, for example, in case you need to decide if you can continue to engage virtually with a particular community. For example, if it's Indigenous and the dangers are just too great, you may not wish to continue engaging in the short term. And we've also provided a decision tree as well for how you might adapt a grievance mechanism. And finally, there are a whole range of available resources in the guide, which you can just dip into as and when necessary. Tips and things to remember and ideas to consider. So I will stop there. Thank you very much.
Muchas gracias, Kate. Ahora quisiera
Thank you very much, Kate. And now I'd like to share with you some of the experiences that our clients have had, for which I'd like to welcome Daniel Mascareñas, who comes from CELSE. And Daniel, I'd like to ask you a question. Hear your experience in the context of the CELSE project. How the implementation of these new strategies of community engagement has allowed you to continue with the communication process and promote transparency. And specifically, can you tell us a little about how the highly vulnerable populations and extremely poor were able to adapt to this new strategy?
Good afternoon. Thank you very much for the opportunity to be part of this webinar. I'm very glad to be able to talk about the work done by our social team and by CELSE. We can go to the next slide. First of all, I'd like to give you some context about CELSE. CELSE owns the thermoelectric complex called Porto de Sergipe 1. This has 3 units. First, we have the maritime facilities, which are offshore. We have a floating unit to store and regasify the gas. We receive the gas, the natural gas there. It is stored there, and then it is transported to the thermal plant. Then we have the thermal plant that can generate 1.5 megawatts, and there are 3 big turbines that are generated by gas and 1 steam turbine. All this energy is transported by the transmission lines that is about 33 kilometers long, and then that connects to the national system. This is the biggest thermal plant in Latin America that is in operation nowadays. And also to give you context about the social work we do, we have a relationship with the communities. There are several communities around this area. We have 10 communities around the thermal plant. One of them is called Recanto dos Cajueiros 1, and they are being relocated. This process was stopped in the beginning of the pandemic, and the community has great expectations and is fearful in that sense. There are 29 communities in the transmission area, and when it comes to the maritime project, we have about 5 fishing communities around it and 2 traditional communities called quilombolas, and they are also in the area we call influence area. So we have 20 programs that are being executed, and we have 10 social environmental programs being executed as well. So as I mentioned, this community called Recanto dos Cajueiros 1 can be seen in the map above. Our work is right next to this community, and this is a very vulnerable community, very poor, very low literacy. There is no infrastructure. The families are very um, destitute, and they don't have good residential conditions. So we are installing, working with the financing agencies, a relocation plan. We have 139 houses that are going to be removed from the direct area and other families that will be benefited by this relocation plan. families, 75 families have their main house near our project, and they will all receive new homes. 57 families had houses there but didn't live there as their main home. Despite this fact, they will also be benefited by the plan. They will not receive a new home, but they will receive something in exchange for the relocation. Right here, you can take a look at what the houses look like. You can see how precarious some of the houses are. They don't have basic sanitation, no electric energy. They don't have water. It is really extreme poverty. And the picture here shows the picture in the bottom part of the screen is a picture of a new house. And so this shows social transformation in this very vulnerable community. The social engagement should be spontaneous, and we try to obtain the participation of the community in the processes that are being implemented by the company. So before the pandemic, we had a certain way of working with communication and engagement, and we had to reinvent our methods, use new technologies, and adapt so that we could maintain a good dialogue and a good engagement with the communities. So on the left-hand side, before the pandemic, you can see that the meetings and the consultations with the participation of the community were done in person, as you can see in the picture. During the pandemic, we had to adapt and use new technological tools. So the meetings started being organized remotely and virtually. So this is how we consult the communities working with representatives. We had video calls through WhatsApp to do this work. Before, the communication actions were done with the distribution of graphic material. With the new situation in the pandemic, we had to adapt. So Celsi prepared several materials with information about the coronavirus, with information about how to prevent the disease, main symptoms, and trying to improve the health of the population and prevent the disease. This graphic material was sent through social media, and here we have WhatsApp. So all the residents in this area use social media, and this made our work easier.
Un minuto, por favor. Gracias.
1 minute, please. Thank you.
Continúa.
Então, só para finalizar, certo. As pesquisas socioeconômicas eram aplicadas por
The socioeconomic surveys were done in person, but then we started working with phones. We used to visit the homes, and now we have been talking to the population by phone. And when we need to visit a home, we respect social distancing. So we implemented good practices. The offices were received some protections, and workers use masks and gloves. We donated masks and gloves to the community too. They received individual envelopes and the community leaders distributed them. The contracts are signed in a drive-through manner, and also we have a reduced group of workers to avoid having big groups together. And now we have contracts being signed, 17% signed during the pandemic. We had 18 calls with the families. We also prepared 14 communication documents. We had 8 meetings, virtual meetings with representatives, and we had 1,800 phone calls and messages sent. This improved our relationship with society, and we strengthened the relationship between company and residents. Thank you very much.
Thank you very much, Daniel, for sharing those experiences. And now I'd like to invite our colleagues in the project, the Cocoa Root, Ilsa and Dolly. And with them, we will establish a conversation. And maybe, Ilsa, you can tell us a little bit about the strategies implemented by the project and how this changed with the pandemic. And Dolly, what things from the strategies that you implemented worked well, and what did you have to leave aside? Thank you. Well, I'd like to tell you, for those of you who don't know, let me tell you a little bit about the project. It is located in 2 different departments in Colombia, Antioquia, and it goes from Bermeja, Bucaramanga, and Aguasandón. And it is made up by 9 functional units, 4 of which are already in operation and 5 underway. 2 of these begun at their construction stage when we were going through the pandemic in August. And this for us was a challenge to begin the construction of these units operating during the pandemic, but we were able to do it thanks to the exceptions granted by the national government. The project has permanent and ongoing relations with the communities through the programs of the contractual social responsibility program that is carried out by the coordinators, and they carry out the work in the field, on the streets, and the communities where these are. This was a challenge for the delivery of information as well as for the development of the activities. And we had to establish biosecurity protocols that were reviewed by the communities and by the local authorities, such as the Santander Convention and the townships and the mayors in Santander, the 6 municipalities that we have in Santander and 1 in Antioquia. One of the important contributions made by the communities to the biosecurity where COVID tests for people that had access to the department. That is to say that they had spent the quarantine outside the department. And we implemented all the necessary social measures. And Dolly will tell us a little more about this and specifically share with us, besides the biosecurity protocol, what other measures were used in the field with each one of the communities. Thank you. Elsa, good morning, everyone. We had a major challenge. Culturally speaking, those of us who are from Santander, and that is the department with the greatest area in intervention in the project, we speak aloud, we speak with our hands, or gesture with our hands. And it represented a challenge because we are also distrustful. And when the whole pandemic thing began, our communities had fear. They were afraid because we have most of the populated centers that are quite remote from the health centers that could provide immediate support when faced with an emergency situation, and at least first aid. So they believed initially that their greatest fear was foreigners who are part of the project. Because in the project, we have Spaniards and we have people from Portugal. So the first people that they did not want to have as a part of the area of influence were these professionals. So the first thing we did with the community leaders was to show them the traceability of the flight dates and that our professionals since December had not left the country and that did not pose a risk because they were discriminating against them. So the fear then was with the people living in the centers, in the populated centers or in the cities. And as Elsa mentioned, we undertook the commitment to show tests with all the professionals and all the workers coming from main cities and from other departments. Because when the pandemic began, Santander is quite a distance from Bogota and Medellin, which are the main cities in Colombia. And these are the cities where we had the highest level of contagion. So Santander had very few infected people. And so the commitment we undertook is that all professionals coming from other departments had to go through the test, a COVID test. And the social management was responsible to undertake that control with all the contractors. So we had a whole list that was drawn up so that they could join the project, and we implemented 2 control points on the highways that lead to the tunnels, to the bridges, and we paid random visits to the working centers to corroborate that all workers were complying with the biosecurity protocols. All this information was sent to the community leaders every week as a brief report of what we were doing, and also to the municipal administration. It was very important for us to enter into agreements with the ministries of health in the different municipalities in Lebrija, as well as Girón and Betulia, so that when faced with an outbreak or in emergency situations, they will give us priority. And with this, we were able to have the communities resting assured and be calm and reassured about it. It was important for everyone to have good connectivity, so we conducted some tests, coverage tests. The social professionals addressed each one of the leaders. We wanted to test whether Team or Zoom or what other tool or platform could be better, taking into account the signal, the connectivity signal that we had. And we established meetings with all institutions. And the communities were rest assured because of the commitments that we established. And we also facilitated the connection because we had stopped seeing each other, but the video made them feel that we were present. Once when we made these measures more flexible, we adapted a socialization strategy in open spaces as a sort of an open air fair. And in groups of 5 people, they had to go through each one of the stands, and they received the topic. There was a stand devoted to how we had done the licensing, the entire process, licensing process. There was another stand where we reported on the design, the technical details of the project, the social issues, and what were the measures from the environmental point of view. And this was very successful. Now, regarding our relations in spite of the lockdown and the measures that we had during that recession. Thank you, Dolly and Ilsa, for sharing that experience of the cocoa root concessionaire. And now I'd like to invite Fanny Rivera so that she can tell us about the experience from EPM, the Public Enterprises in Medellin, with the Ituango project. So Fanny, if you can tell us a little bit about the challenges that you faced, and how have you been able to overcome these challenges, particularly during these days? Good morning, everyone, and to all participants, thank you very much for this space. I'd like to leave three messages in this seminar. First of all, to describe the project of Ituango and the importance for our country, what was brought by the contingency in the project, and how EPM got ready to take care of the communities during the COVID pandemic. So for this, we are now looking at the Ituango hydroelectrical project. It is located in the northwestern part of the Antioquia department, 170 kilometers from Medellin, in the area of influences of 12 municipalities. All of them contribute to the works of this central hydroelectrical plant. It generates energy for the country, and what we're currently seeking is for this energy to cover 70% to all Colombians. In this regard, we intend to project an underground plant of 2,400 megawatts of installed capacity. And as you can see on the image, it has a height of approximately 240 meters, which is equivalent to a 17-story building. We can see one of the important works in this hydroelectrical plant, which is the dumping site that works to 100%. And this initial project began in 2010. However, by 2018, we had a contingency, and many of you might have heard about it, that there was a contingency generated in the downstream municipalities of the project. And this contingency can be summarized at three different times. One, it is a closing that we had on the right-hand tunnel of the Fauca River. There was a deviation of the river, and secondly, there was a blockage in one of the tunnels. So this led to an impact on Puerto Valvidia and other municipalities downstream. But these are municipalities that are left under the hydroelectrical plant. And in 2019, there was a closing of doors, and this was a decision made by the project in order to safeguard the life of the communities. And since then, we were able to see that whenever we have a contingency generated by the project, this leads us to having a massive evacuation. And when we speak of a preventive massive evacuation, we're talking about 17,200 people approximately. So this gave us approximately a relation of 5,400 families. And of these, in the Valdivia municipality, we had 2,490. So most of the families evacuated settled down in that area as an average. And all of this was done on the basis of the national system of risk management. And all the rescue entities took care immediately of these communities that were being evacuated. And after that evacuation, they left the temporary shelters and they moved to safe housing. But by self-housing, they obviously continue with attention of the psychosocial impact on these families and the attention given to children and women. And it was all done close to them. Visits, meetings, workshops. And when the pandemic hit us, the COVID-19 pandemic this year hit us, what does it generate for public enterprises? Well, it brings with it a change. We had to reinvent ourselves, and reinvent ourselves as a challenge because we had to take care of the same families that had been covered by the project in a contingency and that were in the process or recovery or in being provided care, and that now were also affected by COVID. In this sense, we had to implement strategies such as these. We had interinstitutional articulation. And in here, we bring in all the non-government administrations, police, firefighters, a bank, and hospitals, because we had to give indemnity to these affected families. And so we bring in the operator, and the Antioquia Corporation is also supporting us in the social management under Cauca. And after that, we developed and we implemented some protocols, which enable us to do this virtually by mail, by chat, by WhatsApp. And it had a plus, these notifications, and it is that we generated a tool that created a code that we call hash code, which is a special and unique code per each claimant. We also have a virtual line, like a hotline, and the office as such existed by the company. But with the COVID, we had to implement actions, virtual actions, such as mail, telephone lines, so that the people could come closer in order to submit their request. And in June this year, we begun the meetings that were almost face-to-face, having the agencies and entities that are present in the community and socializing the protocol that EPM has. Psychosocial attention continues. It is lagging behind, and now it is implemented virtually. And obviously, the communication plan is an information strategy that had to be developed and had to be much more robust in the area, because we had to mobilize all communities with a chat, with bulletins and newsletters and press conferences. And we cannot forget about the relation that we had with leaders, community spokesperson and representatives. And we're very grateful for that, because they were the bridge and the channel of communication between the enterprise and the community. Thank you very much for sharing that experience, Fanny. And now I'd like to invite our last panelist, Julio Rojas. If you can tell us a little bit about what the challenges of the IDB group have been in order to work with executing agencies in community participation and virtual consultation, stakeholder participation, and what has been the result. Thank you for the invitation. Good morning, everyone. It is very interesting to be the last one to speak, because many of the things that I was going to say have already been said, but I work in the safeguards unit, which is social and environmental safeguards of the IDB, looking into funding to public institutions, and the challenges that we faced with the clients that we have were essentially linked to 6 points. The first one, how to innovate and to adjust the techniques for the face-to-face consultation and moving to virtual consultation, and the follow-up that we had to do in the process of preparation and implementation. The second topic is that the group, the IDB group, worked on protocols for speedy response to COVID. So these were protocols that had to do with health, amongst others, that had a very short period of time for their approval. And if necessary, the consultation process, whether it was category A or B, they had to be carried out anyway. So there were no waivers in the preparation process. So we need to follow that adaptation process. We also have a guide that helps us carry the virtual consultations in the 4 languages, the 4 official languages of the bank. Now, regarding how the processes were done, the planning processes, first we identified the tools available, and they've already been mentioned by our colleagues, the previous speakers. Facebook Live, Teams, telephone calls, WhatsApps, etc. And levels of accessibility.
Latinoamérica y el Caribe, digamos, tiene
The region of Latin America and the Caribbean has levels of accessibility in telephone services that have been growing in cellular telephony, but internet cannot necessarily take place not with good coverage. Something that really surprised us is that we work in educational sectors where we have educational platforms of which we were able to hang up. and follow these in order to have these socialization processes. What have we learned? Well, the only thing constant is change. We move from a situation in April and May where we had mobility throughout the region, and we had to move to mixed processes. This has resulted in an experience of having 100% of virtual consultations and also processes, mixed processes where we have a combination or a hybrid process. We found points in favor of these virtual consultations because in some cases we have greater participation. In the past that they didn't want to go to an office, there was a certain barrier in going to an office, and now they can participate, and that is important. Obviously, we have to take into account the special situations regarding vulnerable population, indigenous populations, etc. And this is the work that is going to continue, that must continue. There are several challenges that continue, not only when we are working on the project, but when we're implementing the project. And here I'm showing some photographs of an experience that we've had. This is an operation in the transport sector. The executing agency is called the Provía Centralizado, which is a division or a unit under the Ministry of Transport and Communications in Peru. This is work where the rehabilitation and conservation of department streets and ways will take place. This was a project that had 6 corridors where we had to participate. So it covered from the north of Peru, a region that is called Tumbes, all the way to the south with the Tacna region going through Cusco and Madeiros. So the planning process of the consultation had to undergo adjustments. So we started preparing this project last year in November when we still did not have anything linked to the pandemic. And when we had to move on to the consultation process, we had Peru with restrictions in mobility and meetings, which were quite serious. So what did we do? And in recap with what the colleagues did, we created a web page, something that was quite innovative, and I'm showing this. As you can see, we've been following an infogram where we had all the social and environmental documents, and we had pigeonholes so that people can communicate. We also activated a telephone line to take care of queries and consultations on the public consultation. We distributed invitations by email and WhatsApp. So these were radio invitations in the different locales. In Tacna, in Cusco, these were done in Quechua and Amari, and there was a generalized participation. And this was not necessarily all virtual. We also had to establish personalized interrelations with certain stakeholders that did not have the possibility of participating in the Zoom that was created for the consultation process. And that is how we came to the result where a virtual consultation on the basis of a Zoom platform where we had 133 users participating, 66 men, 52 women, and individual interviews where we had 150. The greatest concern was when do I begin the work, the measures for the control of the pandemic, employment, and they participated in all the area of influence. And to conclude, the public IDB has supported the planning of the consultation processes throughout the entire region, Brazil, Paraguay, Argentina, Peru, Central America, and the Caribbean. So we believe that there's still a lot to be done. We are currently reviewing the guides that we have. We're undergoing a standardization process, and what we want is to have a better communication process. I'd like to conclude by saying that, like many of you know, the bank's board approved in September this year a modernization of the policies. So they will come into force as of next year, and we're in the process of implementing these. So it's also been a good opportunity in order to get ready to the change that will take place in moving from operational policies to safeguards. That is all that I have to share. Thank you for the invitation. Thank you very much, Julio. And if you have any questions, please put it on the chat. I'd like to invite all panelists so that you can you can turn on your cameras and to invite you to respond. This is a new normal. And along the way, there have been several adaptations. A few things have represented an improvement for the system or in order to manage community relations that you had in the past, and others you've had to leave aside. So I'd like to go through each one of you, and maybe you can share with us one or two lessons learned that you've had from this process. What practices are here to stay, and what are those that you tested and didn't work? If we can begin following the same order as we did with the presentations. So maybe Daniel, if you can tell us a little bit about that. And then we go on to Elsa, Fanny, and Julio.
Daniel, estás con tu micrófono apagado.
Daniel, you're muted.
Hi, Fiorella. I believe that the big learning experience in our region was to understand that this social group that was being impacted by our actions in such precarious situation without any infrastructure, well, we had we never would imagine that this audience would adapt to tools and technology. It was a huge surprise to us when we saw that we could not be there on site and face to face to see that such a poor community, such a low income community was able to use cell phones and making use of WhatsApp and other social media. So during the diagnosis stage, through cell phone communication, we did identify that it was possible to communicate with them through video conferencing or cell phone calls. And this made the whole process feasible. They were really worried because, of course, a resettlement project has a huge impact on people's lives. And if the company did not maintain that communication, these people would really be unhappy. So thanks to the use of these technological tools, it was possible to maintain our project. People still trusted the company. Our relations improved and the engagement and transparency processes were much strengthened thanks to these tools in spite of the pandemic.
And adding to the previous question, Elsa, what are the technological tools that have worked the best for you? Well, it seems to me that WhatsApp has been one of the main technological tools that has worked well in order to disseminate information. And maybe it was not so widely used. And we needed that face-to-face presence, going to meetings, person in person, providing news in a face-to-face context, but we saw that WhatsApp is a good tool in order to reach these communities directly. Information is provided quickly, expeditiously, and we solve the concerns directly to people. It can be done through groups or individually. So I believe that for us, WhatsApp was an individual tool. It was very good for meetings and other things. Yes, we have others like Meets, like Zoom, but in the case of information, I believe that WhatsApp was the best. And Fanny, the changes that you've brought about in Ituango, which one of these new practices that did not exist, that you had not tested in the past, now because of the context, what are those that are here to stay, that are part of your stakeholder engagement? Yes, Fiorella. It worked quite well to be connected through Teams with focal groups, email, and for the specific case of the project, the downstream project, these communities did not have a connection. And we went through an exercise with the leaders of the communities and with some families to teach them to get connected. And now they have email, they have text messages, and they know how to send them. And I believe that these tools that we use, and I believe that the bridge that we established with the leaders, being able to train the leaders, first of all, to reach those communities that did not have access to these technologies. That has proven to be useful, and we will continue to work them hand in hand. Thank you. Perfect. And Dolly and Julio, please add to this on an issue that we see in the questions that had to do with remote populations with a very weak internet connectivity. How do you reach them, and how do you involve them in the process to get closer to these communities?
We'll begin with Loli and continue with Julio. Well, yeah. Uh, Actually, we had a collaborative process at the initiative of the leaders themselves. We identified in each one of the streets the places where there was the best connection, and either in the store or in the higher area of the city or the village, we identified the place. And when they had meetings, we programmed an hour and they'd go to the place and we were able to get the connection. So they also had identified the need to communicate with us and recognized that that exchange was necessary. They contributed with their time so that we could identify the places, and that was fundamental. Thank you. Perfect. Julio, and we'll end with you. Well, in the projects that we've been working with, there have been very good experiences in Paraguay, for example, where uh, the connection with the community was difficult. We used the local actors, the municipalities were able to project, and the people kept the social distancing, but were able to find out about the project and even share some of their viewpoints. Of course, the phone was used as well. And yes, if there are serious limitations for access or lack of electricity or power and lack of connection, well, we simply have to have teams sent out so that they can use maybe some type of quarantine in the area and so forth, whatever, but always being very careful. That's what I have to say. Okay, thank you. Thank you all very much. Our time is up, unfortunately, and this is a subject that has many different aspects and are of interest for all social actors. And we tend to speak too much, of course. So I do want to take advantage of this opportunity to thank all the speakers and the participants. And we at Bit Invest are awaiting any questions or doubts. You have all our contacts, and have a great rest of your day. Thank you. Thank you. Thank you.
Thank you for
Thank
the
you for this
opportunity.
opportunity.